to anatomical facet orientation, thoracic segments generally idle in a neutral kyphotic position. Segments made up of 3 vertebrae will sidebend and rotate to opposite sides in what we commonly refer to as a type 1 curve. This will dictate how you position the patient for your adjustment and also how you position your hand as the fulcrum for the vertebral movement. The principle is that you are encouraging improvement in range of motion that addresses the barriers that you have found to be restricted. Before you perform an adjustment, you need to test and figure out what it is that you will be adjusting. You can use segmental motion tests that should have been a part of your training, as well as observed deviations in the spinal segments that you wish to address. Determine what the position of the segment is, where the middle vertebrae within that segment generally represents the apex of the segmental motion. This will guide you as to the barriers you need your adjustment to address. Once you have a position of the segment and the barriers you need to engage, it's time to set up your adjustment. Remember, safety and accuracy are your primary concerns. In this case, let's assume the position or the lesion of the T4 to 6 segment is sidebent right, rotated left. So the barriers I need to engage at that segment are sidebending to the left and rotation towards the right, with my contact being primarily on the T5 vertebrae. This 5-step process will help you achieve the basics of a safe and accurate thoracic spine cuddle manipulation. Step 1. Position the treatment bed just above your knees. It may be slightly different depending on your body makeup. Lay the patient down on their back, making sure that you have a flat, firm contact surface between the patient's spine and the treatment bed. Seeing as the segment is in the rotated left position and we want to move it into right rotation, we will approach the patient from their right. This allows us to place the palm of our hand under the patient in a fashion that allows for vertebral rotation movement to the right. Place the patient's arms across their chest to the opposite side, making sure the arm on the other side of you is on top. The patient's elbows should ideally line up. If they don't due to increased flexibility, you may need to pack their chest with a rolled up towel. This may also be useful for patients who have sensitivities with their chest or breast tissue. The main idea behind this is that you begin to pack the patient for a tight setup so that your forces are not dispersed and go directly to the segment you wish to adjust. Step 2. Place a folded towel over the elbows of the patient. This will help you maneuver their thorax and also protect your stomach area from the forces of the adjustment. Place your hands over their elbows where you just put the towel. Begin to apply a downward and clockwise force on their elbows. This will begin to pack their thorax and engage the left side bending barrier. You will need to be firm and controlling with your contact to get maximum packing of the thorax. When addressing lower thoracic segments, you will need more inferior elbow movement. Firmly press your hands on the patient, moving your elbows into a full lock as you rise up onto your toes. Lean over the patient as you move their packed elbows under and into your umbilical area. The further you can get over the patient, the better the packing. If this is done correctly, you should be able to move your hands off the patient's elbows and have the patient be securely and tightly packed into your stomach area. Step 3. Take your left hand and place it under the left scapula of the patient. Use this hand to drive their torso firmly up into your chest area as you move into a split stance. This secures the patient and packs them firmly into your body. Bend your knees and begin to move the patient's torso off the bed, just enough so that you can position your right hand under the segment you wish to adjust. To get your hand positioned correctly, open the palm of your hand and move your wrist into 45 degrees of ulnar deviation. Keep your thumb open and close the rest of your fingers to the pads of your palm, leaving a space between your bent fingers and the meaty, thinner part of the thumb. The spinous processes of the segment you wish to adjust will sit nicely in that space, and your thinner prominence will control the direction of movement of the vertebrae. The more wrist extension you use, the greater the emphasis is on rotation. Once your hand position is set, place your right hand under the apex of the segment you wish to adjust. Step 4. You may now further reinforce the side bending barrier if needed, and you should be feeling a very firmly packed patient torso into your stomach. Your hand should feel comfortably squashed between the patient's spine and a firm bed. You can play with your wrist position to engage rotation. When adjusting upper thoracic segments, you may need to shift the direction of your force through the elbows into the upper thoracics. This may require that you play with elbow position so that you feel the squashing force on your hand. Your hand position may also need to be narrowed to fit in the space between both the scapulas. If you don't feel this, it's unlikely that you will achieve a successful direction of force. This may take some practice, as it is here that most people lose the tight packing structure and their forces become dispersed. Step 5. When you feel a tightly packed patient torso on your stomach and a comfortably squashed hand position, take a hard Valsalva breath and push air down into your lungs as you harden your midsection. Apply a fast thrust by dropping your knees and body weight on top of the line of force you have created between your midsection, the patient's elbows, and your right hand. In the process of the downwards nature of your thrust, you may slide your left hand from the back of the scapula to the front of the shoulder to help with your force going down. An audible cavitation is desirable but not absolutely essential for success. If you get this right, you can keep the packing and do multiple segments by simply bending your knees and moving your right hand to the correct segment as you keep driving their chest into yours with your left hand. Once you have finished, come off the patient and unfold their arms. It's now time to retest to see if you have made changes to the segment based on the testing you performed prior to your adjustment. Retest the same motion test that you performed before the adjustment to check if you're happy with the change in range of motion. The failure of this technique can be largely attributed to insufficient packing of the patient and keeping them tight through the adjustment. Practice your packing and keep the patient tightly held into your chest. The achievement of the desired change after a retest would indicate a successful adjustment. Now it's time to apply these steps in the clinic and refine your technique.